Hey everybody, welcome back to Dental Unfiltered. I'm Matt Brown, and we're here with the amazing Dr. Todd Fleischman again. We're doing a multi-part series together. The first part of the series was what's it like to be a practice owner in a city. And today we're talking about a subject that I'm really excited about. Me and Todd met a couple months ago, and we talked about what we could talk about together. And one thing he said, which I really agreed with, the relationship between a specialist and a GP. And I talk to dentists every day. And throughout the last couple of weeks, I've been kind of throwing this conversation and ask. And one dentist said something that really kind of made me feel like this is an important subject. What he said was he was a new dentist in the area, 4 or 5 years out of school, bought his first practice, was just getting to know the specialists in the area. And he said, when I approach the specialists, it feels like I am going to the principal's office when I speak to them. And there's an anxiety there, and there's who leads who and who is really in charge of the patient and whose patient is it really. And I think that's really important. So Dr. Fleischman's here, and this is an awesome subject. And he actually spoke about this at Dental Boost Camp on stage of who should quarterback. And I would love to unpack this and rip it apart and give dentists a bunch of confidence so when they go, it's not the principal's office anymore. So go ahead, Todd.
Hey, Mac. Great to be here. I really appreciate the opportunity, of course. Super excited for this series, and I'm really thankful for it. So thank you, of course. Yeah, I mean, I would say the conversation with the specialist is coming from a general dentist like myself. I'm a comprehensive clinician, but I'm a general dentist by trade, is really critical. I don't do almost any specialty procedures in my practice. I just don't. It's just not my style. And so I'm very much reliant upon my specialists here in Center City, Philadelphia, or in the suburbs to help me with comprehensive patient care. Those relationships aren't always the easiest to establish, right? All of us are very busy. Specialists have a tendency to just have this, cachet about them where they are more educated. They've spent more time. They've worked a little harder typically. And so because of that, they have this reputation about them. And sometimes for general dentists, it could be challenging to kind of find their way in with a specialist. I found that there are methods and there are tricks that you can do to try and ingratiate yourself with them so that you can actually develop a relationship. Because just like with your patients, your relationship with your specialists are incredibly important, right? But if you think that you can just call them when you're in trouble or to get you out of trouble or to take out the tooth that you cracked the root on or to find that second canal or the third canal on that root canal, or to save you from the veneer case after you already accomplished it, but now things are breaking, that's not the way to establish a relationship with a specialist. And I think out of respect, first and foremost, generalists should understand that you need to build a bridge between the two of you, whomever the specialist might be, before you hit them with only emergencies.
Before you make them your safety net.
Yeah, your safety net. That's not what they're there for, right? You as a clinician need to understand what your limitations are. You're certainly allowed to go outside your comfort zone, something you and I have talked about, right? Which is important for growth. But you also have to establish a relationship that makes sense for you. And oftentimes specialists, they're human too. They don't want to feel taken advantage of by their generalists, and they want to make sure that it's a symbiotic relationship. That being said, specialists oftentimes, especially with young clinicians, just have more experience. And with that comes a little bit of an intimidation factor oftentimes. I know when I was a newer clinician, I wasn't sure how to approach a specialist because I wasn't sure if they would agree with me, if they thought I didn't know anything. You're vulnerable.
You're probably nervous to even give your opinion.
100% you're nervous to give your opinion. And the thing is, oftentimes in that early relationship, the specialist is older than you. Right. And I have found that when you work with specialists who are more around your same age, they can almost be a little bit more collaborative. Whereas the ones who sometimes are a little bit older, maybe toward the twilight of their career, it's more difficult for them oftentimes to establish these relationships unless they're really progressive, which I've known specialists in the past who are like that. They want to meet young doctors. They want to continue to grow their businesses. It's important for them with these relationships. But it can be a challenge to break through. So you have to be patient and you have to approach a specialist with information, right? Not with them just saying, hey, tell me what to do, but here's the information. Let's collaborate on a solution. Let's bang our heads together until we're aligned. And those conversations as a young clinician oftentimes are just difficult to have because you don't have the clinical confidence yet, not only within yourself, but certainly not to present to a specialist, just like you're saying, like a principal's office, like you would present to your attending when you were in dental school. And it sort of gives off that, it evokes that emotion, right? That when you're presenting to the specialist, you're back in dental school presenting to your attending again, right?
And you
you're
were
like,
probably just doing that, and probably that those feelings of anxiety are probably familiar.
They're fresh, right? They're really fresh. And that's something that you have to sort of push past and understand that, yes, these specialists are thinking about what you're saying. Yes, there's a judgment on some level to know where your head's at and how much they can tell you and how much they can help you or not. But to just assume that whatever the specialist is doing is the right way to do it is also not the answer. Because I've had many, many relationships with specialists where their judgment and mine are not aligned. And we have to figure that out before implants are placed, before root canals are done, before bone is plastied, right? And so communication, period, is really the key to that success.
Everyone knows I'm not a dentist, but I try to put myself in kind of your shoes and your thinking as much as I can, especially with my profession. While I work on the marketing side, I really invest in that. And I feel like there's kind of a loop, right? So it's like, it's kind of, you're hitting off batons. So it's like, I go to specialists for my patient, and our views conflict, right? Well, ultimately, if I send that, if I just yield to the specialist and say, well, you know more than me, here you go. Well, that baton's still getting passed back to you. That patient's going to back in your chair. And if you were right and they were wrong, and we have a bad scenario now, the yielding to the specialist saying, here, you just do what you think is right because you're the specialist and you know better than me, could end up being a very bad in-chair scenario back at the practice later.
It's 100% true. I mean, it's definitely true. I mean, I've seen it happen, right? And sometimes, depending on the person you work with, they don't want to collaborate at all. I mean, that's not the relationship that you want. I mean, as a generalist, it is the specialist's responsibility to feel like they are willing to ingratiate themselves with the generalist, right? Otherwise, it's never going to work. And so there are some specialists out there who don't feel that way, my way or the highway kind of stuff. And plainly, those are not the people that I'm collaborating with, right? It behooves a specialist, especially if they're practicing fee for service, especially if they're practicing the same philosophical realm that you are as a generalist, you have to be aligned. And finding your people to align with is a critical part of the equation. And then, again, making sure you're communicating them with them in a way that your message is clear, your goal for your patients is clear, and doing, typically when you're working with a specialist, comprehensive care and understanding what the end game is going to look like before you touch a person's mouth is something that you should be able to collaborate on, whether it's with the specialist, but I would also add in the laboratory to that for what I'm doing, Matt.
Oh, yeah, right? The lab's part of that circle.
Critical, right? Especially when we're doing these hybrid cases, these full arch cases. Yeah. You have to be able to communicate not just with the specialist, but you, the specialist, in the laboratory. And
you have three forms of communication, three avenues of communication. Correct. You have the information with specialist, information from you, and then the lab receive the information, putting it all together. We know how much lab cases get messed up. This is a high probability scenario.
You have to bring, as the generalist, in my opinion, you are the quarterback. Doesn't mean you have to know everything. Two things can exist. You can be the quarterback and still not have full knowledge about how this case is going to come to fruition, right? That's why you lean upon your specialist and your ceramist or your lab technician to collaborate together to try and come to a conclusion of what you think will be best for this patient. Typically, those are evidence-driven decisions. Sometimes they can be anecdotal in the sense that this has worked in my hands, this has worked with my experience in the lab, this has worked with my experience with the specialist, and we make choices based on the results that we continue to get. When you're starting out, you don't have that pedigree per se. You don't have that history to be able to depend upon. And so you have to establish it. I'd like to think that I work with as my specialist because I'm able to, again, to communicate with them in a way that's very clear through photos, through modeling, through 3D scanning, that is critical in putting all the information pieces together and then finding the time, which is very challenging with among all our busy schedules, to collaborate together. And that's why part of running your business is also making sure that you put time into your schedule for not just the actual physical dentistry, but the thought processes involved with doing dentistry also, right? With the planning, with the non-chairside work is critical. And as a young clinician, you typically don't do those things because you think it's taking away from chairside. But in reality, when you put some time away for it and you're able to focus on comprehensive care, your production changes, your chairside time changes, your value per hour changes. and you really start to work instead of single teeth into comprehensive care, which changes sort of the overall proposition value of your practice. And so all of it is a trickle down effect, right? If you want to do more collaborative care, if you want to do more specialty level care, then you have to step aside from the single tooth stuff and start to look at things more comprehensively, which then engages you with your ceramist, engages you with your lab, and forces you to engage with your specialist. And you're also committed to building that relationship. Specialists want their work to succeed. They do. They just don't understand the restorative component at all. Unless they're perio pros, I found, and that's a very rare specialty to begin with. Unless they're perio pros and understand.
So you're saying perio and prost, or perio prost combined?
So it's a combined specialty, right? Where they've gone to school for periodontics, they've gone to school for prosthodontics in the same degree. Usually it's 5 years after dental school, right? It's almost like getting an oral surgery degree, if not more. And these are just high-level clinicians who can just see restorative and perio together. Most cannot, because it's not how they're trained, Matt. It's not their fault. No, it's not yet. Right?
I have a lot of
just like it's not our fault.
And then I have some prost, and I've tried to work with oral surgeons.
So surgical prost is similar.
And when you have prost and then oral surgeons, they're kind of very divided in the way they look at things. But surgical prost, we found from placement to restorative, thinks about the whole process, where just pure prost is just waiting for the implant to show up and throw the thing on top, right? So it is very different thinking.
Listen, the reality of it is that you're going to make a lot of mistakes along the way. And 15 years into private practice, 21 years into practice in general for me, I've made the mistakes from the communication or the lack of communication with specialists or labs. And you learn that you need to give them more, right? It's our responsibility to give them more information. And if they don't have the information from you, if they don't have the guidance on some level, doesn't mean you have to know exactly where everything's going, but the guidance on some level, then they're going to make their own decisions, because in the middle of their day, they're just going to put the implants in where there's bone, right? And then we're stuck to dealing with it, right? Or the endodontist is just going to get the patient out of pain, whether they know the tooth is restorable or not, right? And so you kind of have to do the due diligence. It becomes our responsibility to spend more time doing the upfront research to understand what the long-term outcome is going to result in.
Sometimes I think about it, there's a whole bunch of stuff that comes to mind. From what you just said, tons. One is, what is the specialist thinking on the other side? So like if I was a specialist and you called me, whether you were inexperienced, experienced, or a stud, I would want you to come to me with all the facts and all the information and all the data and say, hey, this is the outcome I'm looking for my patient. I know my patient. This is your section. You tell me about this section, and I'm going to tell you what the outcome is. I think as a specialist, if you came to me that way, I think I would be way more inclined to want to work with you, because every time this young doc calls me, he's prepared with all the stuff. He knows the outcome, and he knows his patient, knows what he wants. And he says, I need you to focus here. And I think you really need to realize this. The specialist is you have to kind of like direct the specialist and focus it where you want it, or him or her. And then I think they would appreciate that, because then it's kind of like not like the two of you kind of reaching around in the dark. Like if you come to them prepared with everything you want and everything they need to make a decision, I think the specialist would really appreciate that.
They're always interested in seeing the level of the generalist that they're working with, right? And interestingly enough, I get a lot of reverse referrals from my specialists, because patients who have general dentists who finally get to the specialist because the general dentist finally realizes that there's like a problem or they need help from somebody. And the patient goes to the specialist and they go, boy, this experience is different. Because typically it does feel different at a specialist office. They have different systems in place. They have more education. Maybe they're providing a little bit more service. Maybe they're more fee for service typically, right? And so the general patient goes to the specialist and goes, boy, my general dentist sort of let the ball drop on this one. I'm looking for someone who can quarterback this care, who's going to give me the best result when this is done. Do you know somebody, now that I'm at the specialist office, do you know another dentist? And now that's a very funny position for a specialist to be in, to be like, listen, I just got referred you from this dentist, and now you want me to put you somewhere else because you're getting a bad vibe, right? Well, I don't want to give my patients bad vibes. I want them to go to the specialist, understanding that we're being proactive. that I'm giving the specialist lots of information. So when they sit in the chair with the specialist says to them, Dr. Fleischman has sent me photos. Dr. Fleischman has sent me scans and x-rays. We've already discussed your care, or he's written me in a thorough email telling me what the expectations of this treatment is going to be. And now the patient's in the chair going, boy, Todd did his due diligence. Todd has built value for this experience, right? Todd is worth spending a little bit more extra money on because the previous experience I had, the guy did none of this.
Here's a referral slip, and I'll call the specialist and tell me you're on your way over.
Or here's a referral slip, call on your own time. Like that, it's like call on your own, let them know we're sending you. We wish you the best. That's wild, right? Like no one leaves my practice without my team setting up the consultation.
So listen, I want to talk about that. So if you're listening, listeners, and I really never talk about my company on the podcast, but over at Energize Group, we book 20,000 dental appointments a month. Okay, we collect a large amount of data. It's crazy. And we collect data that's out of control. And we track all the patients, right? Whenever a patient, it's like 9 out of 10 failure rate. When a patient is just given a referral slip and saying, call this doc, do it yourself, never happened. And they might go somewhere, but they're not going where you want them to go. And they tend to not come back, to be honest. You're kind of shipping a patient off into the unknown. And it's kind of like, I don't sound like this, kind of like rolling a snowball up and seeing what its chances are in hell. You're like not really giving it any probability of success, right? But Todd, what's scary is that's really common. Oh, it's not like, listen, that is not abnormal. Like I would say it's the majority, to be honest. And I feel like there is like, for me as a patient, right? So I'm not a dentist. If I was in a chair and somebody's like, and Todd Fleischman came in and said, hey, Matt, I looked at your mouth. You need this implant here. Your bone is bad. I can't do it. But what I've done is I have my friend, Dr. X over here. I have already gathered up your images, your CBCT, my notes. This is Sarah. She's already sent them over. Sarah is going to go up front with you right now, and she's going to book you an appointment with Dr. X, and Dr. X's team is going to book the appointment back to return to me. When that's done, the fear of the unknown is removed, and the patient feels like they're being guided and cared for. When it's here's a referral slip, you call, make an appointment. What that is lazy. And that means you're not being loyal to your patient.
Yes, all those things, all of that. That is exactly right. It takes more effort. I spend my nights writing letters to the specialist. Here are my notes from today's visit. Here are the photos that I took. Here's the expectations of care. Here's where the conversation is going to start. Once you've met her, please call me so we can collaborate, right? Like and then once you establish those relationships, it's not that challenging. You have your core group, right? It's already there. And then every time it gets easier and easier. And the beauty of it is when they start to see the specialists, especially the results that they get because of this collaborative care, they want to continue to perpetuate that results driven solution, right? And that's really satisfying. It really is. But you have to lead a horse to water. It just reminds me, not to interrupt you ever, but it reminds me that patients know nothing.
They have zero dental IQ. Listen, I have docs that come to me and they go, can I have patients with more dental IQ? I'm like, no, they don't exist.
No, they don't exist. They know nothing until you educate them. So you have to lead a horse to water. We lead every patient through every process in our practice. We don't even let them sit in the reception area without understanding where to sit. I literally tell my team, if they're waiting at the front because my admin is busy, bring the patient to a reception area, point to the seat that you want them in, guide them directly. It takes so much anxiety off of the patient. They don't even want to have to think about where they sit down in the reception area. They don't want to have to think about it. They're like, do I sit here or do I sit there? Take all the decisions away from the patients and guide them toward best practices. They will appreciate you.
The patient deals with enough anxiety when they show up to the practice. The more control and decision-making ability you take from them, and the more you become a guide and they're put on a set path, like a train on train tracks.
They just want to be led.
They want to be led. You're the subject matter expert. You know better. You be confident. When you're confident and lead them, it's kind of like a child-father relationship. If your father isn't confident, isn't leading the family, you don't feel secure. Your confidence and ability to lead that patient is what makes them feel secure in what's going on around them. If you seem even 10% unsure and I have high dental anxiety and I don't want to implant in my mouth, I'm saying no that day or whatever it is, right?
No, 100%.
So thinking about it from the specialist side, right? I have Dr. Smith and Dr. X, and Dr. Smith is referring me people. And every time I get it, it's the patient shows up in my chair. I have to reshoot images and I have to figure things out. I know they're coming in because the most I know is the patient tells me that my doc said I don't have enough bone for this implant right here. Like, I don't know much more than that. Now I got to do all this background work and I got to do all this stuff, and it eats up my time as a specialist. I'm not very excited to handle your patient. I'm not excited to refer back. Now, when Dr. X sends his patient over, and before they even got there, my team had everything, and I have things I can review during that consult, and I can turn to the patient and look them in the eyes and say, your doc sent this over. They took this last week. I looked at it. Doc did a great job. This is what's wrong. Me and doc are going to communicate. Then the specialist isn't really this external thing. It becomes an embedded part of the team.
The team, exactly, right? We have the patient's best interest in mind. This is your team. I'm developing a team for you, right? By the way, that's a medical model, right? Anything that they do is team related, right? There's not one single person doing anything. Only in dentistry do we want to be on these islands by ourselves. I don't understand it. Now, I'm very fortunate. Oh, well, that's 100% true. But I'm fortunate, right? We could go back to our first pod, which was city dentistry, right? City dentistry has a couple of advantages. One is specialists, typically. We usually have great specialists in close proximity to us, right?
Just for sure. You do right across the street. Walk across the street.
Right across the street.
Go to floor 4. Go to room 205.
Yes.
That almost seems like you're in the same facility then.
Yes.
It almost does. You're not driving 20 minutes away. Oh, that's so effective.
It is effective. It really does help. It builds relationships. It keeps people convenience and keeps their treatment moving forward. No, I mean, there are systems that you can place. I mean, I teach them that are so simple, but you do have to spend a little more time. But if you're sending the patient to a specialist, then you're probably getting specialist level treatment being done, which means that you probably have a more lucrative or productive case situation going on.
It's not like a $2,000 mouth. It's probably like a $10,000 plus mouth.
So you should spend more time on it, right? Like you should invest more in it. Like that is our jobs, that when we're doing high level care, we're doing the appropriate due diligence to get a predictable result, right? Evidence driven result.
Being from the military background, like I always try to be loyal to the mission outcome, right? And our mission, or you guys, your mission, not mine, I'm not a clinician, is to do what's best for the patient all the time. Right? Every single argument in dental can be won with this truth. Are we doing what's best for the patient all the time? If you are sending them off with a referral slip into the ether of the world and hoping it works out, you are not doing what's best for the patient all the time. If you do all the due diligence, all the prep work, all the planning, you meet with a specialist, you send it over, the specialist then can do what's best for your patient all the time. If you don't do that, in my opinion, you really don't care about your patient enough.
Yeah, I mean, it's hard to disagree with that. It is.
Doc, if you're listening and you're in that practice, look in the mirror tomorrow and be like, do I really care enough? Could I take extra 10 minutes? Because really, like, you're not really doing a lot, in my opinion. Though, Todd, if I say this and you're like, Matt, you're full of it, just call me out on it. In my head, what I see is, you grab the data, the discs, the thumb drives, whatever it is, with the images, you put them together, you send them off digitally somehow, you copy your notes, you send them off digitally somehow, you have maybe a 15-minute phone call. I don't know the length of that, I've never done it. And then you have some communication in the middle. That doesn't seem like it's a lot of work, but I think it might be a problem is if you're not taking good, timely notes as the dentist serving the patient, and there's a whole lot of other crap you're doing wrong that's hindering you from doing this right.
You have to have systems. You have to have a way that you do it. We have a system to practice. It's not just about us communicating with the specialist. It's also setting my team up for success, which I think is a very important detail, right? So when we have a patient, even if it's a simple root canal referral, okay, to the endodontist, we write a referral. We copy that referral so it goes into our document center in our system so that we have a copy of that referral. So when a patient calls, if a specialist calls, my team is set up for success. So they know where that patient got sent to. They know what the procedure was going to be. They know the timing of that procedure. And so if things get lost in the ether at some point, we have a record of how we can get it back on track, right? And so it's not just about sending the patient out with the referral. It's also making sure that your team has a copy of that referral, has a record of it in the system, because those things get lost very quickly. You can have it in a clinical note very quick. Oh, sent patient to Dr. So-and-so for a root canal. If that's in the middle of 50 notes, you're never going to find it. But if you know to look in the document center, because the patient calls and says, blah, 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 I went to the specialist, you go, what specialist? But you look in the document center, and now all of a sudden a copy of that referral's in there and the letter's in there and everything's organized. Well, then now you can have an educated conversation, or your team can have an educated conversation with that patient, and it makes them know, not just think, but know that we are communicating with our specialist. That builds value. That allows you to charge differently. It allows you to have a different experience with your patients. It allows for better clinical success. And so all those things are critically important. They really, really are.
Mango Voice has a new AI product where it does all the phone calls. It transcribes them, puts them directly in the patient's chart in the practice management software, and it's searchable, and it gives you a sentiment as to how good the conversation was. So in that scenario, if we put it in the document chart, if we put it in the document, the digital documents, right? But then if we were in the practice management software and we could search the conversation and search the specialist's name and have it right there in the chart, or if you as the doc, as you open the chart, could see that being documented in multiple places allows for the sharing of information to be so uniform that the ball isn't getting dropped. Like, it's redundant, right?
No, and you can utilize technology now. I mean, there's no question, for sure.
I feel like part of the problem is, and you know better than me, is that I think we're in the middle of a technology renaissance or revolution right now in dentistry that is so exciting to me. I am excited that I ended up in dental the last 5 years because it is Star Trek. It's happening in amazing ways. And I feel like 10 years ago, which I wasn't in dentistry, maybe it was very common to, here's the referral slip, one phone call over there, we're sending someone over, you go figure it out, then come back to me. Because I don't think it was very easy to share the information like it is now. But now that we can share the information, I think the standard of care in handing someone off has changed now. And I think if you're doing it the old way, you're not really at current standard of care, which there really isn't standard of care for this, but this is an example I use, right? And I think that's what it is. Like, there isn't an excuse today. Every phone call is either recorded or transcribed. Like, everything's searchable today.
But there's also more nuancy things about it, right? People don't want to be charged twice for the same things. It's unfair to make your specialist not charge for a CBCT if you took one, but you didn't give them the information, but they need one, so they got to take another one. Yeah. People don't want the radiation. Not that there's a lot of it, but they don't want to have the idea of it. They just don't want redundancy, right? People don't have the time for it. They don't have the money for it. It is our responsibility to set patients up for success. Now, I also think that in a fee-for-service model, leading with service, it's our responsibility to do this for patients, right? There's really no other excuse. There's no other excuse. And you have to differentiate yourself from, and not that insurance-driven practices don't do this, because I know fabulous ones that work beautifully that do the same level of service. So I'm not throwing anyone under the bus, but certainly our practice has to do it, right? There's no question. Or else people will go, why am I coming here if you're not providing the service to get me to the patient, the place, in the right time, at the right place, with the right specialist? That's my responsibility. And I tell patients that. And I think it's fine. And then it just becomes gaining the confidence over time, building the relationships with the specialists so that you can have clear conversations, set appropriate expectations. Ultimately, like you said from the beginning, setting us up for the patient's best result, right? All that matters is that we're doing what's best for the patient. And as long as we lead with that, then you never can go wrong. That's the thing, and if you don't compromise when you speak to a patient, if you let them know that this is what's in your best interest, that any alternative treatment plan is not going to work the best or isn't going to be most predictable, then they will understand, right? People will make the right choice. You just have to guide them toward it.
I think docs sometimes think of the specialist only in like two ways. I think there really should be a third way. I think the first way to think about them is safety net, which I think shouldn't be until you have a relationship. Second way to think about is like only for things I can't do, right? So one is like, I'm in trouble, help me. Next one is I can't do this, they can do this. So like, you can place an implant, I can't. But I think a third way that they should think about this is, does adding a specialist into it, even if it's a procedure I can do, but maybe I'm not at the level they're at, does that create a better, more predictable outcome for the patient? I think that part's never talked. I think if you talk about what is the role of a specialist with a GP, it's always save me or do something I can't do to augment me. But what about predictability for the patient?
100%. I mean, we talk about that with ortho a lot, right? I do some minor tooth movement in the practice, but if I'm doing a big case and I'm setting up a new bite or I'm setting up a case for veneers and I need some nuanced movement, I'm not doing that ortho, right? Because I'll look at the patient straight in the face. I don't do it the best. And it behooves us to involve the specialist to set us up for the most success, right? And so that is really important. I think that's a really strong point that like, it's not just about what you can or cannot do. It's about the best experience for the patient and getting the most predictable result. And also, it's about medical, legal, and a little bit of a litigious society, right? There's something to be said about spreading the love around, right? About having somebody spread the risk, have someone else involved. Well, that's how I feel. That's a big reason why my personality is not driven by risk. I'm risk averse, right? That's why I chose not to do incredible specialty procedures unless I feel like I can do it at a high level. Because if and I tell patients this, if I can't do it the best in my own mind, I'm not doing it. If I can't do this treatment as good as the specialist, when you can walk down the street here, then that's not really my practice style. There are places where you can't get to a specialist when you're in the middle of Montana for 3 or 4 hours drive. That's a different scenario, right? That is a different style. But coming back to city dentistry, it does intertwine with specialties because oftentimes you'll see more specialists around metropolitan areas because they need more patients, right? They need more quantity. That's just the nature of it. And so we have more opportunities. So it's our responsibility to build those relationships, feel confident in our approach, but not come to them meek or uneducated. Coming to them with information will hold you in regard with these people who have trained longer than you. They have. So you have to accept that, but you're allowed to be on the level with them. You are.
And you have to remember, they started out where you were.
Yeah, and by the way, they chose to go a different path because they didn't want to deal with the complications that general dentistry affords us, right? Like, it is complicated. We have to have more equipment. We have to be more knowledgeable at everything on a little level. Specialty is fabulous because they're focused on one thing. There's opportunity there. You have to find ways to take advantage of it.
A lot of times the intimidation level is so high. I think there's a fear of like bringing this information and maybe them finding a kink in our armor.
I find it disconcerting that singular experience are allowing us to judge each other, right? Singular experiences. Like, I have a bad phone call with a specialist. Okay, they now think about me in a certain way. That's a singular phone call with a singular patient. That doesn't mean it has to define your relationship, right? You could then have choices to decide, did I feel okay about that? Do I want to work a little harder? Do I want to educate myself more? It certainly became easier to have specialist conversations when I graduated from the Coy Center, when I went through the whole SPEAR curriculum, when I understood what I wanted things to look like, when I understood what the outcomes were supposed to be and the systems involved and the order of the treatment. It allowed me to have educated conversations with the specialist. So that also becomes the generalist's responsibility to say, hey, how much have you educated yourself? How much have you invested in learning how to communicate with a specialist? How much have you invested in learning how to do comprehensive care that requires the need for a specialist? If you don't know those things, then everything you look at, everything that you diagnose from a patient is diagnosed from a generalist's perspective. And that's a shame, because we shouldn't be just diagnosing based on general dentistry. We should be diagnosing based on what are the actual treatment outcomes that will get the patient the best result. That might involve specialists. How do I know when and how to make that referral?
I think sometimes docs look in the mouth and they go, well, I could go to a specialist and do this, but I can do this here and do that. And then I'll do it here because I'll do it. Right. And that ends up becoming a scenario where it's like you're being very selfish, not loyal to the patient, right? I think if you went to a specialist, right, you were prepared. He said, hey, we're developing a relationship. Here's all my stuff. For us to do good together, how would you like this to be from me so I can work with you better and I can tell you what I need back from you? I think having that conversation is really helpful. I think back to your point of us not having time, or you guys, I would say us, you guys not having time to work like this together. I think not carving that time out ends up creating the other scenario. Like, just make the time to have the conversation and say, hey, you're here and I'm here. We're in the same market. I'm going to have patience for you. I'm prepared. This is my level of preparedness. Do you need something more than this, less than this? And this is and then stating the expectation of this is the finish line I want to cross to my patient. How do you get to that finish line?
Well, it all happens in phases. That's what I was about to say. Like, to think that conversation happens the first time you have it, it doesn't go like that, right? But you have to, so I will, because when I was starting out, this is before digital anything, right? I would take my mounted models and go to the specialist's office.
No way.
For sure, man. It's not like an unknown thing, but like
I'm not from dental in that time period.
So just to let you know, like, this is what you did. Hey, Peter Greco, this fabulous orthodontist in town, I don't understand where to go with this case. Can I come to your office, look at models together with you, and have a discussion about how the work that you do and the work that I'm expecting to accomplish mesh with each other? And any quality specialist will be thankful to do that, right? It is difficult to carve out the time. You do have to work harder to get there. You got to get in the car. You got to get on the street, or you're going to get on the subway and go there. But I will tell you, it pays huge dividends. And once you do that a couple of times with the orthodontist, with your periodontist, with your oral surgeon, then you don't need to do it anymore, right? Because you've now established this communication that you understand from each other. You don't have to be knee to knee anymore. You can now, with the technology, you can do a Google Meet call and go on ExoCAD and design things together. I have a call set up with my lab and my periodontist coming up in the next week where we're going to be on a Teams meeting. He's going to have his screen up, showing me where the implants are being placed in the lab, how the prosthetic fits within it. I give approval. I go, no, I don't like the way that looks in the smile. I have an opinion. You have to have an opinion, right? I don't like the way that looks in the smile. Bring that in, which means you got to move the implants here, which means the specialists take more bone away there. These are the conversations that you have to have. You have to know where you're going. How do you know where you're going? Well, how do you treat and plan a case? What kind of data are you being driven by? Is it photos? Is it models? Is it scans? How are you putting those puzzle pieces together? That comes with education, right? But the relationship with the specialist typically happens in phases. And to get yourself out of the office, out of your seat, and go sit knee to knee with someone is incredibly powerful. Right. And because it happens less and less these days, Matt, right? Because people aren't sitting knee to knee like you and I like to do, then the relationships aren't as strong. And I can tell you from most of the people that I work with, I've had knee to knee conversations with them. And because of that, they respect my approach. They respect our guidance toward these treatment outcomes, and the work that we do becomes predictable, right? Which at the end of the day, full circle, is in the patient's best interest, right? That's what we should be driven by. We're doctors.
Yeah, I think the predictability thing doesn't get talked about enough in this scenario. I think it's always like save me, do something I can't do. Not you start, I end, and what is the predictability for the patient, right? And what it kind of brings to mind is going back to my background a little bit, working in the special operations community. I was on a long range surveillance team, and what we would do is we'd be in a room and our mission was anywhere on the one side of 18 hours, right? So we'd go document someone somewhere. And I've never done it live, never done a real mission, just everyone knows. But that was my job. And they would bring us all this information. We would plan it. And then they'd put us in a room, and we had no officers on our team. We're the only place in that world where you don't have an officer. It's all enlisted. We'd go into a room full of officers. Let's call those our specialists. And we would pitch our plan, and they would ask us critical questions. And then after all of us pitched our plans, we then would pick one. So it was like the GP coming to the specialist. The specialist doesn't know a lot about what we do. We don't know why they want us to do it on the upper battlefield, the way they want us to done. And together we come up with a good scenario, and then we execute, and then we come back after and we debrief. So my next question is, after the case is done, is there a follow-up conversation that should be had?
Yeah, it's such a great question, man, because the answer is yes, of course.
Awesome. Let's get into that.
Again, when you're into practice for a certain amount of time, 21 years for me, 15 as an owner, you learn from all the things that you do all these years. You must learn from not only your mistakes, but your successes, right? I mean, all of them. Both things exist. You learn from mistakes and you learn from successes. And there are times when I talk to my specialist and I go, boy, I wish we had moved these teeth a little bit more this way, put this implant a little more palatal, if we could do this case again, we would have done a little less reduction or more, right? Like, we absolutely collaborate. And the beauty of it is, and you have to come to a place of acceptance with this, your results get better as you get more experience because you're a better clinician. it's just the truth. My patients get better care now than they got 15 years ago. You hate to say it out loud, but it's just the reality of what we do. Surgeons, whether you're vascular, oral surgeon, osteopath, doesn't matter what you are, you're going to become a better clinician as you have more experience. Just like in the military, I would assume it's the same concepts, right? That's why you higher rank as you go higher. It's, if we had rankings, right, there'd be like general dentistry level 1, general dentistry level 2, like that would be a thing.
You'd be like master general dentist.
Well, there are these programs, right? The AGD has it, Coy Center has it, Spear has it. You go through curriculums and when you're done, you become a higher level clinician. So that growth only happens through collaborative care when you're doing comprehensive work that requires specialists, right? It just does. And so the goal becomes, how do we continue to get better through every case that we do? And now my cases with my specialists are awesome because we are all aligned, but you have to give yourself some grace. And it's important to hear that. You have to give yourself some grace to get there. And the early cases, when you finish, you're going to go through all sorts of trials and tribulations because they're not going to run as smoothly as the ones that happen 15 or 20 years down the road because you're in a different place in your career. And so give yourself some grace, but continue to build the knowledge that allows you to move in a positive direction. That's very important. Do not stay stagnant. That is not going to benefit anybody.
You have the patient in your chair. You can't do it. Like either it's something you can't do, or you need help for predictability, right? Or you need help because you're in danger. You kind of maybe did something, you got into deep water, right? Then you get the next phase would be gathering the intelligence, gathering the information, having a conversation and handing it off to the specialist. Your team internally then hands off the patient to the specialist. So in my head, the clinician or the practitioner hands off the critical information and starts the planning of the mission or the planning of the treatment plan. The team hands off the physical part of it, the human, right? They make sure they get delivered to the specialist. The specialist receives both. Now the specialist can handle communication better with your patient. And then now you guys come together after they've seen the patient. The next phase is you guys come together and collaborate. And then you, the owner doc of that patient, says execute. It's your choice to execute. It's not the specialist's choice to execute. It's your job to say execute. You say execute, execution happened, patient comes back to you, things are to your standard, things are good. Now you get back together with the specialist to debrief what just happened. And would you say that is the optimum scenario?
I think you nailed it. I think the thing that oftentimes is missed and why specialists really love working with our practice is because we send post-op films, post-op pictures, we show them the results. Well, that's my point. It's the debrief, right? So think about it. You're doing this beautiful case with the specialist. You're giving this patient all new teeth, an upper hybrid, all on 6, all on 4, whatever you want to call it, right? They put the implants in, they transition the patient, or you help them transition the patient to a temporary, and then they pass them off to us. And then they don't see that patient again. They don't see the final result, right? But part of their building their own book is, what does this thing look like when we're done? What's the recare look like? Oftentimes these things need maintenance. So they're living with the specialist over time anyway, right? And when you've been doing it long enough and you have these cases in people's mouths long enough, you also need to continue that education with the specialist because patients run into complications. It's just the reality of it, right? And so establishing those relationships from the beginning, giving the specialist what they need to succeed, having them feel like they've also contributed to the end result, which is the big finish, the big reveal, is very satisfying for them, right? And not something they usually get to partake in. And so when they see our results through photos, through social media, when you're tagging them in things, when you're being collaborative, they really get excited about it, right? Because the specialist, I always joke with my patients, you don't need the specialist to be your best friend. I'm your best friend, okay? All you need is for them to execute what I need them to do for you that I can't do for your best interest, right? So just go to them, have that experience. They're going to take great care of you. His personality or her personality will not be mine. The office experience may not be mine. None of that matters, Mrs. Smith. All that matters is they do what I need them to do for us. Then you come back to me. I get to be your best friend, execute to the finish line, and then we can all celebrate together, right? And it's setting those expectations with the patients, having those conversations to set you and the specialist up for success. When my patient sits down in their chair, that specialist is the first thing they say to them is, I've spoken to Dr. Fleischman. I've received all his information. I know exactly what he's looking for this case. Let me see if I can help you get to that finish line. Right? And the patient goes, wow, that feels really good, because you know what doesn't happen now in most medicine, Matt? Collaboration or communication where patients are involved.
You dentists silo the crap out of yourselves. I'm sorry, but I talk to dentists, and it just feels like you guys get stuck in your own little bubble, in your own little building, in your own little operatories. And for some reason, it feels like just lately in dentistry, or maybe the dentists that I deal with, like collaboration is just like a thing that's uncomfortable.
It needs to change. I mean, the whole dialogue needs to change. I think we have to be less anxious to have the difficult conversations. We're not trained in them. Specialists get different training. They're taught different conversations. They're used to having the most complicated conversations with patients. GPs are typically not. That's why continuing to educate yourselves, learning about comprehensive care, going to these comprehensive postgraduate programs that any dentist can go to, all you have to do is invest in yourself, pays incredible dividends long term.
Well, I think this is an awesome place to end this. I think this was a really exciting, fun episode. I learned a lot myself, because this is a subject that I see happen in the practice, but the scenario I see is when we talk about here's a referral, go see what happens, right? Learning the way you think it should be done. And honestly, so the audience knows, Todd was on stage at an event, and we're gonna end right here, and he was talking about surgical stuff, like a lot of it. And I thought he was a surgical doc for implants. And he's like, no, I just do a lot of these cases, and I work with specialists. And then we started the conversation about specialists and about GPs and how it should be. And then we were like, that's going to be a subject we're going to talk about. So Todd on stage, even from a surgical point of view, he was so amazing, because he is COIS and spear trained, that I thought he was like one of those guys that just could do anything. And he probably could be if he wanted to be, but it was really impressive to me. So, hey, Todd, thank you for coming on. Do you have anything else to say before we sign off?
No, just appreciate the opportunity. I'm happy to collaborate with you, man. I mean, this is like a specialist conversation too, right? It's no joke.
This is going to happen. You're going to be a guest on the show on some kind of consistency, because there's subjects I can attack with you that I can't attack with other people. So you're going to be a consistent guest.
We'll keep it real, brother.
Yeah, for sure. No. I mean, we have to be loyal to the listeners, right? So, hey, everybody, thank you for listening. Remember, Dental Unfiltered has no paid sponsors. There's no way to pay to get on the show. You're never going to be exposed to a sales pitch. We pick these individuals based on either a service we believe in that we've seen be effective, or somebody we've seen speak at an event who we believe is an awesome personality like Todd. It's something we do for you. It's free to the community, and we really believe in it. Below, if you click in the description, you'll see a link to our virtual study club. You can add yourself to it. It's a WhatsApp chat. We have 350 dental professionals in it. We do webinars once a month with different subject matter experts, and it's there for your benefit, guys. Thank you, and have a great day.